Beaches with rough surf expected to continue throughout the islands the next few days. Coming up, explore the natural resilience and beauty of the urban setting of San Diego. That's on Nature tonight at 9 p.m. on WTJX TV, Channel 12.
WTJX 93.1 Charlotte Amalia, your NPR station in the Virgin Islands.
The views and opinions expressed on Analyze This are entirely those of the on-air participants and do not reflect those of the station's board, management, staff, or underwriters.
Good morning, good morning. Welcome to Analyze This with Neville James. I'm your guest host today, Shomari Moorehead. Neville will be back next week, Monday. So you've got me today and tomorrow. Yesterday we had a great conversation on technology. We had entrepreneurs, Keisha Christian and Clyde Daisley. We also had WAPA CEO, Mr. Carl Knight, and Mrs. Chanel Spencer in, talking about the future of WAPA, how they can integrate technology, some of the plans that they have for us and for the Virgin Islands to bring reliable power at a savings to consumers, how they plan to integrate and improve customer service. One of the things that I've learned in my experience as a consultant and a software designer and system builder is that we've got to look at systems, not just technology as a start, but look at the overall system. How do we change systems so that people can want to work with technology? You know, I've built systems for organizations where the system's there and they can use it, but the processes don't improve because the people don't believe in it. They don't believe in an improved process. So you could spend thousands of dollars. And we've seen that in business and government, where you add software, but because the staff isn't convinced, they're not motivated to improve their processes, then we kind of lag behind. So one of the things that we're going to talk about today is how do we do that? Other areas that we're going to look at in tech come from the private sector. So what's the cost? You know, a lot of times people think that technology is expensive. They look at software and say, hey, you know, this is an expensive proposition. It's not worth it for my business. And so they continue. I was talking to my kids this morning about, you know, what they see. You know, my 10-year-old, I have 4 boys. He was just talking about the quality of internet at school. You know, sometimes they can't get their attendance done because, you know, it has to be done by paper because the internet isn't working. Or I've had teachers complain, hey, you know, we have issues where students are taking tests online and the internet goes out. Internet's not fast enough. So how do we bring more reliable technology? And how do we get the system builders and the leaders to believe in it so that they can provide solutions that work, not simply bringing in computers or bringing in internet, but making sure that it works for the people who need it the most. Outside of that, you know, nonprofit organizations, I sit on the board of 3 organizations, and one of the things that I've seen is that, you know, organizations suffer when the staff and the boards aren't working effectively. And so looking at how we can take technology and help them with that. One of the things that we've done is build a board management software. Because one of the things I've seen is, you know, we have a lot of nonprofits don't have the capacity or the finances to have a full staff. And so we've taken things like meeting minutes and using things like AI to automate, you know, creating minutes and creating agendas and analyzing board documents and keeping track of board terms and setting out reminders and mailings to keep the public informed. One of the biggest complaints I've heard from one of the boards that I'm on is that we haven't done a great job of keeping people informed. And so how do we use technology to do things like that? So those are part of a lot of the conversations. I know between today and tomorrow, we're not going to get through all of them. one area that I've seen that I would love to touch on that we may not get to is transportation. I met a young man one day. He told me, hey, I live Mamiju, and it is so hard to get out, to just vote. And if I try no run on time, and I know Public Works has been trying really hard to get an efficient schedule of public transportation. They even went so far as looking at a vendor to put up a schedule of when the buses and track where the buses actually are. So if you're out looking for a bus, you don't run out knowing that the bus is, an hour away. You take your time to get there because you can see exactly where the bus is. Those are modern conveniences that other, jurisdictions have that we need. And so he was, really frustrated that he can't get a, modern system to get him from where he lives to the things that he needs to do. So he can't stay out late. He's like, I can't come to Rhythms of Sunset because, the bus doesn't run after 6 o'clock. And I think you would improve your ridership with data. You would improve your ridership if people believed in the system and could trust that, hey, if I'm waiting for this bus at, 8 o'clock, it's going to be there at 8 o'clock. So people look for alternatives. They invest in cars and they get, friends to take them where they got to go, versus, believing in the systems that should be serving them. The other area that we may not get to, but is equally important, is agriculture. We have so many organizations that help with agriculture, but where's the data to really transform the industries? In St. Croix especially, we have a lot of land, but we have the Department of Agriculture, we have the Agricultural Business Center, VI Good Food Coalition, and Farmers in Action. I know I'm missing one other one, but how can these organizations work together to bring technology to our farmers? Are our farmers ready for technology to improve their operations? There's a lot that we can do in such a small space, and I'm hopeful that we can use tech and we can bring tech into into what we're doing. Outside of that, while I wait for our first guest, she's on her way here now. Talking to Keisha Christian yesterday about the pharmacy and looking at Virgin Islands coming back home and building the largest pharmacy on the Virgin Islands was definitely an accomplishment. Very impressed. And so, how do we get more businesses to come back? How do we get more Virgin Islands to come back and really go through the grunt work of building a business, building a sustainable business, and investing in Virgin Islanders? Because it's not easy. And tomorrow's conversation is going to touch on some of the challenges that Clyde and I talk about with funding. I've talked to investors and said, hey, can you bring capital to the Virgin Islands? And the story we always get is that you guys are too small. There's nothing ever really built in the Virgin Islands or in the Caribbean as a whole that serves a global market. And so how do we find alternatives for that lack of capital? And a lot of times people think that, okay, well, $5,000 is enough to throw behind of it. But $5,000 is maybe 3 daily news ads, 3 full-page daily news ads. So we need access to larger capital. We need access to bigger systems to help us grow and to really, take advantage of access to growing our businesses. And especially in the tech space, banks don't lend to businesses with intellectual capital. They like tangible things they can hold on to. I remember going to one of the big banks in the VI and I said, hey, I'd like to get $100,000 to start a business. This is after I left IBM and came back home. And he told me, give me $100,000 in a CD and I will lend you back $100,000. And I said, well, I'm not going to pay you to use my own money. And he said, well, you don't have anything that I could hold on to if you don't pay back. And for a place like the Virgin Islands that has one of the lowest default rates, and you can look this up, I was shocked. So I got up and I walked out and went to another bank when we built our payroll software. And I said, hey, we have this payroll software. Virgin Islands businesses don't have easy access to do payroll online. And they said, wow, we love that idea. We have a lot of people who need that service. And I said, well, I need access to, automated direct deposit. And they came back and said, actually, no, we're not taking any more customers in that space. So, it's kind of like people say they love the progress we're making, but they're not willing to support it in a meaningful way that helps us. So it's a challenge, and it's one of the things I'm going to ask tomorrow's guest. You guys will find out later this afternoon who that guest is, so we can get growth options going. If you're interested in calling in, the numbers today are 340-718-0764 or 340-718-4555. 4555 to just talk about tech in the Virgin Islands and some of the things that we need. While she's on her way, Miss Barbara McIntosh Jackson, the BMV, is going to be our first guest. She should be downstairs shortly. And then tomorrow's guest, we got some young people coming up to get their perspectives on things that are the future, Things like artificial intelligence is the buzzword today. Everyone's looking at, hey, how can we include artificial intelligence? I know a lot of firms outside the Virgin Islands are looking at it. Locally, we've taken advantage of it. We've built software systems that allow us to reduce churn. So looking at, customers who are inactive and not communicating with us often. So being proactive and reaching out to them. Looking at sales and how we have opportunities for growth. And so I've actually had this conversation with a lot of businesses. But again, back to my earlier piece about folks are afraid. People don't want to invest. They think it's expensive. And when you look at the cost, it really comes down to, if you do it well, a couple $100 a month. Good morning. Good morning. We got our first guest in this morning. Have a seat. Catch your breath. How are you doing today?
I'm good.
Good. Oh, yeah. Everybody tells me that traffic from the west, especially if you take North Shore Road, it's bad.
Yeah, it's bad.
Yeah, come with the 5 corners.
I didn't know that.
Good.
I don't ever come west in the morning. I mean, east in the morning, so I wouldn't know.
Well, Miss Barbara McIntosh Jackson, how are you doing?
I'm good. I'm good. On yourself?
Great. Thank you for joining us.
Thanks for having me. I really appreciate it.
How's the new year been to you so far?
Good. So far, so good. A few challenges
Okay.
here and there, but nothing that I can't overcome.
I know. Which is one of the reasons why I asked you to come, because you have been one of the most transformational leaders I've seen in government. And so I'm impressed. And when I look at your circle of friends, I think of you as a slightly the generation of before me. But when I look at your energy and the things that you do, I feel like you're a generation below me. So I'm impressed. I know when our earliest conversations, you told me about one of the things you would love to do, and that was to transform BMV. And you've taken it from a place where, people complained about, it takes a day or 2 days to get things done. There's these long lines, people sitting outside, and you transformed it into an organization where, if you come in there, it's 20, 30 minutes max, sometimes 10 minutes. What was that experience like?
The experience was long.
Mm-hmm.
It was arduous, and challenging, but rewarding. What we did, though, was I basically looked at, and then when I said we, the management team, we looked at the current operation. This was way back in 2019, and we looked at the current operation and decided that first we need a strategic plan.
Mm-hmm.
We have to have a plan because we were just basically just doing things. And we felt, we looked at what it is that we can do to affect a long-term change, not just the immediate change. And primarily it was staffing. We didn't have enough staff. It was staffing. It was processes, the manner in which we're doing things. There was a lot of redundancies, a lot of waste. And so we went about attacking those. We also included some services that we felt that we could have introduced and some that we could have delivered better.
Okay.
Right? And giving all of the totality of all of those things, We mapped out a course as to exactly how far out we can go, and it basically, for the most part, worked. We basically followed the script, followed the plan. There were some changes, of course, along the way. Things, you have to change some stuff. So we did. We're still changing.
So I was using my conversations as a model of what to do. You didn't simply, and I'm sitting from the outside, you didn't simply throw more computers and more technology at the problem. You looked at your systems, you looked at your people, and worked with them. I know one of the things that I heard you tell me from before was that you didn't want people to feel like BMV was a place they had to sit for 30 years and work. You want them to learn a skill that they could use to move up to another position within a small organization, or to move to another department or another business with a skill set that would help them grow.
Correct. And I'm not afraid of that. And I tell my staff all the time, while they're happy and comfortable for the most part, everybody's not happy, of course.
Correct.
For the most part, don't be afraid to leave.
Yeah.
Don't be afraid to move, because they're being prepared for the next level.
Yeah.
Not that it's a bad place to work. It's a great place to work. It's a great place to start your career, basically, because we hire a lot of young people, because everybody doesn't want to go to college, so we hire a lot of young people who just want to work and empower them for the next level. We reiterate to them a lot, think about your future. Think about where you really, really want to go. Do you want to sit and type for the next 30 years? Do you want to sit and cash for the next 30 years, be a cashier? What is it you really want to do? And a lot of times when you speak to the employees, they have their vision, they have their goal. And so we try as much as we possibly can, given our parameters, to assist them to get there. So, and you're correct. That's what we feel, and that's the conversation we had. So, someone who is the computers and the technology and stuff that we are introducing is also preparation. So we use Microsoft products a lot in the office. That's what the government uses, a lot of Microsoft products. So we make sure that they understand how to use the product, that they are trained how to use the product, so that if they leave the BMV, now they don't have the BMV software to work with, they could work with just about any other software that's available to them, or have a basic understanding of how to do that. Customer service. We are big on service.
Yeah.
We do a lot of training. Every year we have an annual training with the staff. We include customer service because we know that is a lifeblood, because you could be the best computer expert. You process a document in 30 minutes or 20 minutes really fast. But if the service, the communication and the manner in which you treat people, if it's poor, people are going to remember that.
Yep.
They're not going to remember that they're out of there in 10 minutes.
Yeah.
So we include that as well. We try to explain to the staff that, you have to treat people the way you want to be treated. And so we emphasize that a lot. So it's a combination of a whole bunch of things that we actually put together.
Financially, what's that investment been like? I don't want actual numbers, but when you think of, what your budget was when you came in there versus the cost of investing in your staff, investing in their mindset and their future, was it a huge burden, or was it, worth the investment?
I think it was worth the investment. We didn't actually spend much more than we normally would have.
Well, that's good to say it again, because people think it's expensive.
No, we didn't. We didn't spend more than we normally would have. The initial improvement in the software, of course, it did cost us some money, but in the back end, we are seeing the return on our investment. So no, I don't think that, if you look at it dollar for dollar, and I always include opportunity cost, right? How much would it have cost? I include the customer's time sitting there waiting to be served. I include the time for managers to sit there and manage, right? So we include all of that cost as much as we can, a percentage up for the cost, and it wasn't a lot.
Wow. All right, we're going to take a short break, and we're going to return to this conversation with Director Barbara McIntosh Jackson at the Bureau of Motor Vehicles. My name is Shomari Moorehead. Listen to Analyze This. we're back. You're listening to Analyze This on WTJX. I'm your guest host today, Shomari Moorehead. With me is Mrs. Barbara McIntosh Jackson. So let's continue our conversation on some of your changes.
Some of my changes.
Yeah.
So in addition to the technology, we made it extremely easy for the staff to serve the customer. It was a laborious task. Mm-hmm. Basically, you have to type everything all over again. Honestly, that's what was happening, almost. And so we changed it so that, let's say, registration renewal, for example. If you're renewing your registration, everything is already in there. We just hit a button that says renew.
Okay.
And update. And that's it.
That's easy.
That easy. And before it was, you basically had to add the person's tag number. You have to add back in the registration number, a whole bunch of stuff. So now it's just basically press a number, and we built in a inventory system. Right? So, you know, the little piece of paper that you get?
Yes.
And the tag and all of that stuff. I mean, the sticker.
Yeah.
The managers will load that in the individual employee's box. Okay. So you don't have to actually type that either.
Oh, wow.
So the system pulls the next one.
Oh, wow.
And it knows that your registration is January, so it pull a January for you. So you don't have to type that either.
So what happens when somebody comes in late? Like, I know, for example, I miss mine because I have my car is in my business name. So my birthday's in March. The car registers in September. And I forgot that I came in October. And they told me that, I think they gave me an October tag instead of September. So if you missed it, do you move to the next month?
Not really. It probably was a situation where we probably didn't have any more tags.
Got it.
Yeah, because sometimes we plan for tags as well.
Okay.
Right? So we know that per month average, let's say there's 3,000 cars that are being registered in the territory. So that's how many tags we will buy, plus 20%.
Okay.
For new purchases. Sometimes it's way more than that.
Got it.
Sometimes it's way less.
Okay.
So you can never really get it just right.
Yeah.
So it may be one of those situations where that month it probably had way more cars than we've ever expected. Like December is always an influx of cars. So we know we have to order not 20, maybe 30% more tags.
What about September?
Well, September, something happens in September this year.
September
Usually it's
babies?
August.
Christmas babies?
Probably. It's August and December. So something happened. But if you want to change your registration to 1 month, you can. You can request that and we'll change it.
Really?
Yeah.
Okay.
If you want, like I say, it's your birthday.
And I'd love to get everything done in the same month.
So you can
come back twice.
So the next time you could ask us to change it. So you could ask us to change it. No, that's fine. It's gonna cost you, but you can change it.
Okay.
Yeah. So those are some of the I'm giving you an example of one of the changes that we made in the system, right? To make everything that's much easier on the staff. There's not a lot of typing, it's just a lot of clicks and they're gone. So we did that. But to the customers though, which is more important just as important to us, is the processes. Right? Mm-hmm. So the processes, do you remember the back and forth process?
Yeah.
We tried our best to get that under control. Sometimes there's still some of that, because there's always some misunderstanding. We take into consideration that everyone may not have the ability to comprehend at our level or read. So everybody's not really literate, and we get some of that too. So we have to slow all the way down and make sure that the customer understands. So on the back of each form, we have very, very copious instructions as to exactly what you have to bring, different scenarios, especially for the new titles. We've always have a lot of conversations back and forth about that. So in the back of those forms, it tells you if you're a business, what you have to do. If you're a person, what you have to do. If you're doing business for someone else, let's say you're not here, you give somebody like a limited power of attorney or authorization to do business on your behalf. The notes are back there as well. So we encourage our customers to look on the back of the forms, and the instructions are there. We would highlight for you exactly what is required and expect that you follow through. So we did that. We've updated our website as well to make sure that we have a lot of information in there. Sometimes we miss some stuff and people would tell us, well, it's not there, or they don't understand it. If 2 or 3 persons were to tell me that they don't understand something, we would change it because we feel, it's something for us to look at.
So you actually really listen to feedback?
Yeah, we always listen to feedback.
And you act on it?
Yes, we do.
Okay.
Because if enough persons are complaining about the same thing, then something is wrong. then they don't understand it.
Correct.
Then most people probably don't. If 5 of you don't, to me,
Yeah.
5 complaints is enough.
Yeah.
1 is enough, but 5 is too much. So I will look at it and say, okay, we need to have make a change. So we do that.
Okay.
So there's a product that I really, really want to talk about this morning.
Okay.
One of our products. It's called Transfer on Death. Transfer on Death, meaning you are by law allowed to add a beneficiary to your vehicle. So in the event that you die, and you know we all are going to die, right?
At some point.
Okay,
That's the one
good.
thing guaranteed. That and
Okay,
taxes.
good. So when you die, the person who you name as a beneficiary on that title automatically gets the vehicle. You don't have to go through the probate process, because sometimes some of these vehicles, they're not even worth probate.
Got it.
So except if there's a lien.
Okay.
If there's a lien on the vehicle, near a bank loan or something, the lien has to be satisfied first, and then the vehicle is transferred to the person. Very simple process. Is on the application at the time of titling, when you title the vehicle for the first time. On that application, it's on there to the bottom. It says TOD, Transfer on Death. You just name the beneficiary. You have to just give the last 4 digits of the person's social security number, the name and address of the person. And then once the owner dies, you bring your information in first to verify that it's you, and you get the vehicle. Now, if the vehicle is already titled, we have a TOD form. It's online as well at bmv.vi.gov. And you just bring that form in, have it notarized, make sure it's you, and we add the title, the name on the title for you right now. We can do that.
Wow. So that's not
Simple.
easy.
Very simple.
So one of the things can people type the form up and then wait until they die, or?
No, you have to bring it in, because if you don't bring it in, then we wouldn't know.
Got it.
The assumption is that it may have been done after the fact. We don't know.
Got
I'm a
it.
police officer. I'm always suspicious of everything.
Okay. Someone get to that point next.
So no. So if you have it at home,
Yeah.
laying up in a drawer someplace, and you don't bring it to us, there's nothing we can do. You
Got it.
have to bring it in before the person dies.
Got
And
it.
the person have to bring it in, not you.
Yes.
You can't just type it up and bring it in. The owner of the vehicle is the only one we're going to accept it from, or if you have a power of attorney to do business on behalf of that person.
Got it. Okay. Another question while we're talking about products. So, we've been seeing these things from TSA advertising. If you're traveling and you don't have a real ID, there's an additional process that you have to go through. Where is the Virgin Islands in the real ID process?
The real ID process for us is solid.
Okay.
We've done our work.
Mhm.
We've had our real ID and ID cards verified and uploaded in the library, in the TSA computer library,
Yep.
whatever the fancy name is. You probably know CAC library.
Yep.
So this in there. Our template is in there and it's readable. And we have very, very few issues. Very few. However, TSA has decided that they are going to allow people to travel without a real ID, but you have to pay.
Got it.
So that's a TSA thing. I guess instead of, or if the real ID can't verify for whatever the reason, it's not verifying properly, you have to stand to the side. You go through additional screening, and you can pay at $45, I think, and then they let you through.
Got it.
But we've not really had much issues with our current version of our real ID.
So for people who are traveling, if they want to avoid the additional delays or the TSA fees, whatever that fee is, they should come in and get their real ID.
They should come in and get a real ID. We ask that you make an appointment.
Okay.
You have to make an appointment for driver's license, and only because, again, we pride ourselves with time, right?
Yep.
We don't want people to come, just show up and have to sit there all day.
Got it.
If you're really in a rush, you have an emergency, and you want to sit there all day, that's on
Yeah.
you. We wouldn't have a problem with that. As we have space available, we'd allow you to go into the room. But we try to act based on appointment. Or if there's an emergency, you have a medical emergency, or you have to have a airline ticket, a paid ticket, not the itinerary, to show that you're traveling and you really, really need to go, then we'll try our best to expedite it within a day for you.
Okay.
The process is, to some is slow, but to us is fine, because we know what's happening in the industry. And sometimes it can take up to 30 days based on our volume.
But what if somebody already came in, did all the paperwork last year? So within the last year, they came in to renew their license, but they got one of the temporary licenses or the ones that said, like, I know it happened to me. I had one that said not a real ID, but I had turned in all of the documentation. So do they have to still make an appointment?
No. So what happened last year, and we're still trying to recover from that, we're still trying to clean that up, is when we were transferring from one template to the next, we didn't issue any real IDs because we did not want to continue to issue the old template and people were continuing to have issues.
Got it.
So until TSA approved, which is, it took them like 6 months
Okay.
to approve our new template. We started way before our old template expired, thinking that we were ahead, but
Yeah.
us and every other state, we were doing the same thing. So we weren't really special. So we had to wait in line. So by the time they got to us, it was almost 6 months later. So those persons who we were to call back and to come back in to get their license, we missed some people. We honestly did. And so we are asking that if you're missed for whatever the reason, that you were not called back to come in, to please come in. Just walk in and just let us know, and then we would try to expedite. Well, we would expedite the process for you. That's not how we wanted to operate, but that's one of the things that just happened.
Got it. All right. So thinking back to how you transformed the organization over the last 7 years, what were some of the things that were critical to your strategic plan to get to this point? So, you said staffing, getting people up to the spot, so where they need to be. Can you give some tangible examples of things? So for like other agencies, if they're listening and they said, hey, I want to do the same thing. I want to transform my organization where, consumers and residents feel like they're getting a timely response. They're not coming in. Like I have one agency, I always make fun of them, is that I asked for some information back in August, and it said, we'll call you back when it's ready. And it's now January, and I still haven't gotten a phone call back. I wish I could have applied for that information online. I could have sent an email. They don't have any of those options. So for other organizations that are still in this manual process, what are some of the tangible things that they can do to transform their organizations?
So when we started on the online journey, because we felt that going online, having the services available online would have assisted in reducing the number of persons that come into the office, which it did, right? For a while. People like to come to the office. They do. It reduced the amount of persons that came in. And I'm going to give you a story. In January, I think it might have been in March, also February of 20, we went online.
Okay.
Because that was one of the first things that we did. Let's try to go online so people could, go out, stay at home, order their service. We'll mail the registrations to them. They don't have to come in. Any updates you need, we will do that. The only thing you have to come in is just to pick up the driver's license. I'm going to tell you why we still do that. Nobody used the service. It was very, very minimal. We had a lot of PA, very minimal. Then COVID hit. So we were right on time. So it blew up. Right? Yeah. It literally blew up. So we had most of our customers were online. It was during COVID. And so it worked very well. And people, that helped us to allow people to see that the service did work and it was very efficient, and it still is, and very fast. So that worked for us.
So COVID was a blessing to you.
It was a blessing. It was a blessing to us. So, and then our facilities weren't the best, and they're still not. They're still not. So it was kind of hard to control, all of that stuff that was going on. Limiting people standing outside because we didn't let a lot of people in the building. And of course, the newspapers, they're taking pictures and circulating that instead of the real story that we really can't let everybody inside. So that really helped. That worked. Going through that process, though, it was pretty lengthy, to get to that process. We had to re-engineer our software, but of course, you have to plan. So we got our software re-engineered so that we could use it online as well. Plus, in addition to, the software, re-engineering the software, we had to purchase stamps. Something as simple as that. Don't take that for granted, right? Mm-hmm. We had to get with a stamp company. We thought we could just order more, but we had to change our contract with them. So there was a whole lot of moving parts that you have to think about. Something as simple as stamps and enough envelopes, staff. So the thing about online or even over internet services, people think that, it will reduce the number of people that are working, which is not really true. Somebody has to drive this thing.
Yeah.
It's a convenience to the customer. That's all it is.
Yeah.
Your staffing don't necessarily reduce, because who is going to process those envelopes?
Somebody still have to process.
Somebody
the
still have to
paperwork,
process the
stuff them
paperwork.
and get them out.
Exactly. But what we did though, we shift the staff around a little bit so that we were able to not hire somebody for that, but move somebody from the regular operation. Because now we have less people coming in, so we're able to move someone from that operation, from the regular operation, to basically do that, right? So, and again, we talk about customer service. So you talk about online, right? Making sure that that works. So when you're doing online, you have to make sure that the service is still there, is still available, that the people are available to do the processing of the online. And you have to make sure that your information is updated timely, because then you have to make sure that you have someone who can monitor the internet, the web, the Facebook, the whole social media thing. So having online doesn't mean, or a full virtual service doesn't mean that you have reduced staffing. Then we found out that people are calling for information, right? We have the information online, a lot of information online. But for some reason, folks are more comfortable calling the office. So we had to introduce what we call a contact center. So a place where you probably would have been able to go if you contact that agency, where we speak to someone. We have a virtual agent where if you click on the virtual agent, it will give you the answer. But the status of your documents, a virtual agent can tell you.
Correct.
Right? Well, maybe with AI, no. We probably could introduce it to tell us that, right?
Yep.
So we need to have somebody to actually respond to you.
Got it.
Right? Because we have one PBX operator. That person can't answer all those calls.
Correct.
So
all those questions.
Right. So we encourage people to go back to our website, click on the contact center, send in your information in writing, and you can communicate via online with a person, a human being as well. Right? So we did that too. What else did we do?
Well,
Yeah.
hold that thought, because we're getting ready to take a break. When we come back, one of the things that I want to look at is what got you to this point, right? What's your background like? What's next for you? Would you want to take on a bigger role doing more of this for other organizations? Because, like I said, you've done an amazing job with, it's on par or even better than I lived in Massachusetts, I lived in New York, I lived in Georgia. And when I compare those experiences to here, both hands up for you. So, excellent job.
Thank
All right, you listen to Analyze This on WTJX. I'm your guest host, Shomari Moorehead. We'll be back after a short break. Welcome back to Analyze This on WTJX. I'm your guest host, Shomari Moorehead. So, Ms. McIntosh, so tell us, one of the things somebody just asked me about was this point system that's coming up. What's that about?
The point system is designed to curb bad behavior. And it's designed to reward good behavior.
Okay.
So for example, it's supposed to be able to work in tandem, with the insurance companies. That
Okay.
if you don't have any points, if you're a good driver, that you probably get a discount from your insurance, and if you're a bad driver, you get an increase in your insurance.
Got it.
Right, and hopefully you will deter some of the driving behaviors that we see on the roadway. And accidents and stuff like that, speeding. So we are in the process, and we've been saying it, I know, for a few years, but we are actually here because we have to kind of put it to the back burner for a minute to make sure that our processes and our systems and processes are in place properly.
So a perfect example, what's some of those processes and systems you're putting into place now to get ready for that?
We've, first of all, we purged our system. Number one, make sure that the information in the database is correct. We have to be sure of that. We also wanted to make sure that our online process, right, is ready for that, for the point system as well.
Okay.
And then we have to make sure that when we put the system in place, that all the pieces fall into place. For example, something as simple as a notification. We didn't want it to be a manual process where we sit there, type a letter, and say, "Good morning, Mr. Shomari. You have some points that we're going to charge you for, etc." It was going to. Wanted to make sure that there's an automatic letter that's generated to you and mailed out to you or emailed to you. We use email a lot.
Nice.
Right. As a matter of fact, I know you asked about points, but as I say, email. We are now emailing you your receipt when you go to the B&B.
Okay.
So instead of printing a piece of paper for you to walk away and probably throw it away, we email it to you because the government's ERP system allows for email, and it's been there forever. So we just start using it.
Look, I love that because I hate paper, right?
Right. So we will email the receipt and mail it to you, and then we'll actually save and upload a copy to your file for ourselves.
And it saves you money because you don't have to pay for
We don't have
paper.
to pay for paper. We don't have to pay for a lot of paper.
Paper and ink.
Yeah. So when I'm finished with the point system, let me talk to you about a paper reduction process.
Okay.
We have one of that going on too. So for the point system, the Virgin Islands Code Title 20, and I think it's the 800 series, 801 or something like that. It assigns points based on the violation. So points are actually demerits on your driver's license. So a point is a 1, 2, 3, 4, 5 points. I think they're up to like 6.
Okay.
Homicide maybe 6, but failure to wear a seatbelt, I think those are 4, and failure to have a child in a car seat maybe up to 5. Those are big points. Yeah. So if you get up to 20 points, am I saying that right? 10 points, sorry, right? Up to 10 points, you can get your driver's license suspended. Yes. Either 10 or 12. I think.
Does it start from 1 or does it
start from 2?
From 2?
It starts from. I think the lowest is 2. I don't remember what violation that is.
Okay, so I'll give you an example. When I lived in Massachusetts, their point system started at 15. So everybody comes in. When I transferred my VI license to Boston, I started at 15. Every year that I had a clean driving record, I went down a point. And the lowest you can go is 9. I don't know if they've changed it since then. It's been 20 years since I've lived in Boston. But you start off at 15, you can go down for as far as a 9. So for every year for up to 6 years, once you get to a 9, you can't go any lower. And for every infraction, you lose the credit for that year, and you get the points added on. So if you get a speeding ticket, and that's 3 points, you lose the credit for that year, plus you get 3 points. So if you had a 9, you might get up to, a 13. The highest you can go, I think, was 35 before they took away your driving privileges. How does that translate here?
In Massachusetts, things sound very complicated.
It is.
we start at 0.
You start at 0.
Up to 12. I think it's 12 points. Because we start at 0.
Okay.
Everybody starts at 0. Matter of fact, when we launch, hopefully by this summer, everybody's starting at 0.
Okay.
Right. So if you commit an infraction and the judge said that you're guilty, the court would send us a file, because we have an API with the court,
Okay.
automatically, hooked up.
I love that.
Yeah. For tickets too, you can't get away with any tickets anymore,
Good.
Because, the court would tell us, and automatically, once we hit, let's say, registration renewal, it would tell you, boom, they have a ticket, we can't go any further.
I
right?
like that.
So the same thing with the moving violations.
Yeah.
With the moving violations, it's going to be against your license. But the parking violations is against the vehicle.
Got it.
Currently, because we don't have a point system, all violations are against the vehicle,
Got it.
which is unfair to you.
Yeah.
Because you may not be the one who was driving. And here it is that you loan a friend your vehicle. Now it's against your vehicle, which it should have been against their driver's license. So with the point system, everybody's going to start at 0. And as the points accumulate based on the violation, let's say the court said, okay, this person should get 2 points, we'll assign 2 points. And so on and so on until they get up to 12 points, and then your license is suspended. But in between that, you have the ability, that's what you're talking about, getting the system ready. You could go online and check your points to see where you are as a person. Or when you get to 9 points, what we have decided is up to 9, we'll notify you.
Got it.
We'll let you know, look, just in case you didn't know, or you're not aware, or you didn't remember, you're 9 points, 3 more, and you're gone, right?
Yeah.
Your license is suspended. And then we give you your options. And at 12 points, we tell you it's suspended. But between 0 and 12 points, well, not 0, 1 and 12 points, you have the option of going to a driver improvement program. We won't mandate it until your license is suspended. However, voluntarily, you can go once per year as long as you have points and have it reduced by 3 points.
So, what about for those who don't go to a driver improvement program? How do they ever get a reduction? Like,
Never.
so
You
the
never
only
get a
way to
reduction.
get a reduction is to go to a
You go
driver.
to driver improvement program.
So, like, having a whole year of a clean record doesn't give you a reduction in points?
No. Having a clean air of record, just have a clean air record. You're good.
Wow.
Because it costs to go to driver improvement. There's no reason for you to go if you have a clean record. If you're 0, there's no reason.
Correct. But I think, having a clean record, driving for the next year or 2 years and showing, hey, I learned my lesson. I'm not going to speed anymore, should count for something.
It will count if there are points.
Yes, if I have points, right? So
Then, of course, if you have points and you go to driver improvement.
no,
it will
without
be
going to driver improvement. So
No. Oh, no. Yeah, you're correct. You're correct. Without going to driver improvement, yes, you are correct. 3 points.
So if let's say I get a speeding ticket and it's 3 points. So I have 3 points added to my license. And I go 2 years without driving fast, never getting a ticket. I still have 3 points on my license?
No, you will be reduced.
How much?
3 points. Every year, 3 points.
So every year you lose 3 points?
Every year, your points will be reduced by 3 points.
Only if you go to driver improvement.
No. Even
Okay.
if you don't go, you have a perfect record, no more accidents for that year, no more violations for that year.
Got it.
You're rewarded
By 3 points.
by 3 points. Yes.
Ah, that's good.
Yeah, you're rewarded
Yeah,
by
because
3
Massachusetts is
points.
only 1 point.
No, we give you 3. Yeah. So that's how the point system is designed to work.
Got it.
And so we're going to have better explanation, and, we're going to have a whole round of public information and education when we actually start rolling it out. So we're still in the process, but that's basically what I remembered from that. Now, we're talking about, we have a paper reduction initiative that's
Okay.
going on, and as it's ongoing.
Okay.
So we reduced the number of the pieces of paper that we purchased in the office significantly,
Wow.
because we have to save those things. Well,
Yeah.
we had to. We don't save them anymore. We don't in boxes.
Correct.
So we upload everything to your profile. And if you notice, if you go to the BMV, we give you back everything.
Yep.
So we ask you to save it. So what we do is we stamp void on what needs to be voided. We keep what needs to be kept, which is like the original application, and then we give you back everything because we would upload it into your profile in the system.
Nice.
So that's one. Then the same thing with the forms. The forms are available online, and we ask persons to please go online, print the form, and bring them in. That has been working. But we are moving one step further. Very, very soon, we are not going to be using forms, period.
Nice.
None.
Completely online application.
No. You come into the office and we'll complete the form for you.
Okay.
So we've already purchased the little signature pad thingy.
Yeah.
But what we are waiting for is we can't find a nice little iPad looking device that we could put against the wall or against the plexiglass or
Got it.
someplace where you can see what we are typing.
Got it.
That way, you know what you're signing for.
Yeah.
Well, we could deploy it now; it's ready. But I was uncomfortable because somebody may say, "Well, I don't know what I'm signing for. I'm not signing," and we
Yeah.
don't have a way for them. So that's what we're trying to purchase.
Got it.
We're trying to purchase those things so that we could, you could see as we are typing, and we really don't have to type,
Yeah.
Because remember, you are bringing us the document.
Yeah.
You're bringing us an application, and you know what we do with those things? Sit there and type it again.
Yeah.
So 3 of us are doing the same thing.
Got it.
So what we have decided to do, because we already have your information, Shomari. We have your information. You have a driver's license in the VI. We have that.
Yeah.
Now, once you enter the vehicle information, what we are able to do is open the form, like the title application, and tell it, for Shomari Moorehead, we are in your profile, add the vehicle information.
Nice.
That's it. And now you sign.
So I know we got a few minutes left. How does this work with stateside stuff? You know, a lot of times in the past, you know, I went in Boston and they were like, "Hey, you know, you have a VI license. That don't count up here." Even though I was a student, right? I wasn't required to get a Massachusetts license at the time. I was a college student, but they didn't want to pay attention to having a VI license. Will that still be the case? Like, will stateside police officers be able to look up somebody's driver's records in the Virgin Islands, or will you still be required to, you know, request a copy of your driving record and bring it up there with you when you want to transfer your license?
So unless we are not on the system.
Okay.
We are not on the stateside system that allows them to see the Virgin Islands driver's license. And why? Because the stateside system resides on the commercial driver's license information system.
Got it.
That's the system they are using. It's called state to state. Because truckers drive from state to state, they needed a system where they'll be able to track a trucker
Yeah.
going through from state to state. So they decided then to put the regular driver's license onto the same system.
Got it.
And we are not part of that system by law.
Got
It
it.
actually says the 50 states and District of Columbia. The territories are not included. So that's why we're not. The agency, the AMFA, which is the American Association of Motor Vehicle Administrators, the association that we belong to, they have the contract to administer that program, and they have honestly been trying desperately to have a walk around for the territories, which then they were very unsuccessful. So they're still working on it.
Okay.
But in the meantime,
What happens here stays here.
what happened? Huh?
What happens here stays
What
here.
happens here stays in a kind of way.
Okay.
Because if they scan our license and their system can pick it up, because our systems can pick up everything. Sometimes they can and sometimes they can't.
Got it.
I'm not sure if that's a bad thing, though.
Okay.
I really don't. I don't think it's a bad thing. I've had tickets in the States.
Yeah.
Okay, and it stayed up there.
Yep.
So I'm not sure if it's a bad thing. But we are working on it. We are working on a commercial driver's license for the territory. It's not going to happen this year. I know that.
Yeah.
We're laying the groundwork for it because it's very, very long.
Yep.
It's laborious. It's a lot of work. It's a lot of pieces. And we have to make sure that's a federal document. So we have to make sure that we fit all of the federal guidelines to make that happen. So that is why you really can't see the driver's license. So what I did through AMVA, through our organization, you could ask a question, right? So you ask a question of your colleagues. It's called a survey of states.
Yeah.
So I sent a survey asking the states to tell me who takes or don't take the VI driver's license. And I have that.
Okay.
Right. So what I plan to do is to reach out to each state individual to find out why. I'm not for DC don't. I was surprised. I went to visit DC and I asked them if it was a law and they said no.
They just
The law doesn't prohibit them. They just don't.
You know what happened to me in Georgia? We have a car in Georgia, and I tried to renew the registration for the car, and they would not take my Virgin Islands driver's license.
No. Some states you have to have a license in that state to register a car.
No, they said if I had a Florida license, they would take it. Virgin Islands, I wouldn't. So I got out of line. I went to the kiosk. Kiosk took it.
Right.
But the lady at the counter
Won't take it.
won't take it.
Again, see, that's personality. That's probably an old thing that somebody told her and somebody told her and somebody told the next person.
Yeah.
It may not be that it's true.
Yeah.
You see what I'm saying? So what I find, you remember licenses are local.
Yeah.
Right? So each state have their own laws.
Correct.
And their own reason for doing whatever. Like here in the VI, because we have snowbirds,
Yeah.
we have people who have dual homes, and they don't want to give up their license from wherever they're from because they're only here for 3 months.
Yeah.
You can't really make them. And I agree with that, honestly.
Yeah.
Right? So when they come to register a vehicle or bring their vehicle down, they could use their passport or their license from another state as an ID, proof of physical address, and they could register.
Yeah.
Right now, it's up to the officers in the street. They have to have that conversation. But
Correct.
for 3 months, we wouldn't make somebody change their driver's license. If you live here, of course you have to.
And that was the thing I
Yeah.
told her. I was like, I'm only here for a month of the summer. It shouldn't have to change to Georgia. And I want to keep a car there because it's cheaper for me for my family and I to keep the car there than it is to rent a car every time we go back to the States.
But that's a state issue.
Yeah.
Right? And so what I try to tell, especially our residents, like I always say, when Virgin Islanders go to the America, I call it America, they are compliant.
Yeah.
100% compliant. But when they come back home, it's all sorts of...
We want to act up.
Yeah, you want to act up when you come home. But when you're in America, in Florida, you have to have a Florida license to register or title a vehicle.
Wow.
Right? And most states are the same. But us, we got a little lenient.
Right. Well, Ms. McIntosh, thank you so much for joining us today.
Wow, we're done?
Hours
my
gone by
God.
that quickly. Thank you for all that you continue to do
Thank
for
you.
modernizing our government operations, starting one agency at a time. So have a wonderful day and all the best for the year.
Thank you so much. Thanks for having me.
All right.
Yeah. Okay.
We'll be back after a short break. You listen to Analyze This on WTJX.
The views and opinions expressed on Analyze This are entirely those of the on-air participants and do not reflect those of the station's board, management, staff, or underwriters. The views and opinions expressed on Analyze This are entirely those of the on-air participants and do not reflect those of the station's board, management, staff, or underwriters.
And we're back. You listen to Analyze This on WTJX. I'm your guest host today, Shomari Moorehead. We're at the 9 o'clock hour. We have two amazing guests in here with us today. Michelle Francis, she's the director of the Office of Health and Information Technology. and Miss Sumaya Bryan. She's the owner of 340 Degree and Delights, and also the Sustainability Program Assistant at the Department of Education. Introduce yourself, ladies. I'll start with you, Michelle. Tell us about yourself.
All right. As you said, Michelle Francis. My current role is the director of the Office of Health Information Technology, which is a mouthful, Health IT, out of the Office of the Governor. Supporting health modernization is the easiest way to say it, using technology to modernize healthcare in and out of government. So I work with our hospitals, our FQHCs, our private providers, Department of Health, Human Services, to follow federal guidelines to help us modernize.
Cool. Sumaya.
Good morning, community. My name is Sumaya Bryan. I'm the Sustainability and Agricultural Education Assistant at the Department of Education. Right now, I'm currently working with school gardens, with teachers on campus, kind of boots on the ground, trying to help my community as much as possible. And also, my boss and I, Director Meadows from Sustainability and Agricultural Education, are building a curriculum for the kids to learn in the schools. So.
Okay. Well, I invited you guys here because I think health and agriculture are two important pieces of our community. What are the things that we can do better? Where are the opportunities? I know, especially in health IT, how do we get to the next level? You know, people always are suspicious of technology and, you know, especially technology in healthcare. So what's the future looking like for technology and for healthcare in the Virgin Islands? How can providers kind of get ready for that? I know we still have some ways to go, but it's something you've been working on for a couple of years.
Yes. Back in 2021, Governor Bryan established this office by executive order to be a collaborative hub because, as is typical, we're a small community, but we work in silos. Everybody does their own thing. We have our own budget. We don't communicate. And so we have a massive lift. To modernize healthcare can't happen in one doctor's office or with one hospital. It's a communal lift. So my office was established as this collaboration hub to provide resources, to provide training and education and guidance on what does modernization look like securely? Because we know in the age of technology, then there's cyber attacks and there's protecting information, and in healthcare, PHI, protected health information, is a big deal. So yes, it's a big lift to know all the federal regulations around how we share data, but we already have put in the infrastructure in the last 4 years to create a health information exchange, and all that means is we now have a highway so that your record can flow to all your providers. So instead of you bringing your bag of medication and a book this big to flip
Which is
through.
always the case.
Always the case.
Yeah.
Then when they say, so tell me what are your last 5 medications? You're like, but your record follows you. Getting all of our providers onto the health information exchange is our challenge, and we're working on that right now. Right now, both of our FQHCs, St. Thomas East End Medical Center and Frederickstead Health Center, are live.
Okay.
But it's like Facebook. If you have 2 people live in Facebook, it's like, eh.
Yeah.
So we're working to get our hospitals on board and our private provider community.
So if all the private providers got on, would that help?
That will, but we've gotta follow federal regulations, and also where the federal dollars flow, they get a say and direct. So the good thing is that our Medicaid providers and Medicaid population gets a boost in this because our major funding is coming from CMS and Medicaid.
Got it.
And so they want to get our institutions primarily serving Medicare and Medicaid populations on first. So that's our hospitals and our FQHCs, followed by our bigger clinics, private clinics, and private providers.
Okay, cool. All right, spinning it a little bit to agriculture, right? Because if you eat better and you
Absolutely.
you start earlier, you avoid getting to the hospital. You avoid having to go to the doctor all the time. And I know that we have all of these different, I was just speaking about it earlier, that we have all of these different groups that help with agriculture. So as someone who studied agribusiness, what do you see as a future for how we can integrate technology to help people do better with eating and with agriculture and producing. Like, I know we have a lot of farmers, and sometimes they're a little bit older, so starting young with kids is a great start. But then what's the roadmap like?
It's definitely hard. I mean, even with me, I'm learning technology. I mean, I've been on TikTok these days trying to promote the teachers and the school gardens. But like, even for me to navigate TikTok is like, like, oh my gosh, like this feat is like so hard. But I mean, I honestly,
It's a lot of work.
yeah, it really is. Like, I'm honestly still navigating that. Like, how can I connect better to my community? How can we connect better to the farmers, especially dealing with farmers who are, I love them to death, but, they're stuck in that age of, this is how it's done. So like new young faces like me can be intimidating coming into those places. So personally, I love an AI. I love ChatGPT, especially for me and my health needs and, where I need to be in terms of my weight and everything. So I've been looking up like certain diets, and then from those certain diets that I look up on AI, and then I'll compare it to walk through the farmer's market and compare it to things that I can be eating from farmers to support the local economy. So that's what I've been doing on my behalf. But it's honestly, hard for other people,
How are the students taking, the agriculture program that you're working on?
They love it. Honestly, it's really something I implore everybody really to go through the schools, because it's easy to like be a cynic from the outside and like scorn and, like throw bad remarks on these schools and the teachers and, everybody just working hard in the schools. But I implore them to really see what our students are learning in the schools. As I personally taking this job, I was very surprised on how much they're learning and what they're learning, even the STEM, parts. And thank God for the RT Park and all the hard work that they're doing in Eulalie and all those other schools. Like, we just got a 40-foot hydroponic trailer for Eulalie. That is in itself is a step in the right direction, because that you can farm like 1.5 acres worth of food in there. So
In a 40-foot trailer.
In a 40-foot trailer. And even that thought, a 40-foot trailer, hydroponic trailer, is intimidating. We still had to do education with the local farmers to show them, like, this is not your competition. We are very much working together. There's enough space for everybody, every farmer, every student trying to learn, or every youth person like me trying to get a farm. There is space. So.
Wow. I like the word competition. Is there room for, and Michelle, you can give your professional opinion on this. Is there room for more collaboration in this space, right? In tech and in agriculture? Because when I look at like farming, for example, we have so many farmers. When I talked to Summer Sibley about what she was doing with VI Good Food, and they talked about how many farmers we have. It's somewhere, I think, like 100. Everybody can't produce the same thing,
Absolutely.
Right? And if we were to have, one or two organizations, you have, Department of Agriculture, the Agriculture Business Center, SBDC, all these different groups, really work with the farmers to say, okay, hey, you three are going to produce lettuce and cucumbers. You're going to do tomatoes. You're going to do peppers. You're going to do mangoes. And then create a business out of that where it becomes, okay, Stop and Shop, Plaza East, the market, whoever, Seaside, your commitment is to buy these produce, but you don't have the four of us all trying to grow lettuce and cucumbers and peppers.
And no mangoes.
Yeah.
Right? There are things that we need, when you're talking about diets and planning. So is that possible?
I think it is. And I
What's
don't
holding us
only
back?
think it's possible. I think that is the future. There's agriculture, food as medicine is already a thing. That's not a concept. It is being used around the world. And so we don't just have to look at the US. Sometimes we're better suited looking at some of our brothers and sisters down island, or even in African countries, that are saying, with technology, being able to use AI and ask, what are the foods that treat inflammation? What are the foods that bring down blood pressure? What excites me is when we can get our healthcare community connected to the HIE, and we're gleaning the data insights instead of just what we do now, which is, me son, a lot of people have depression. Well, what is a lot? You know, is it 50% of the population? Is it 20%? And if we know that 50%, a lot is really 50%, then we can say, you know what, here beets bring down blood pressure.
Yeah.
Anybody growing beets? Incentives can be given from Department of Agriculture. Collaboration is critical. No one agency or institution can do it alone.
Correct.
And no farmer's going to go out of business, because this is only growing. And the more we apply technology, the more opportunities that open up.
And we honestly need to start thinking outside of the box too. I mean, especially young people like me, like, you know, we're not exactly like the Michelin star cooks. You know, we do try our thing, but how do I cook a quinoa that tastes good? You know, how do I stay away from sazon that has MSG in it? You know, how do I use, like, personally, me and my boyfriend, we grow rosemary and basil outside, and we put that in our beans instead. It's different, you know, has a different taste, but it tastes good, and we don't use sazon anymore. So just staying away from the MSG and stuff like that. Maybe doing workshops with cooks like Mota and like farmers, and maybe that's sponsored by Health. And, you know, we're teaching our community how to eat better. So there are stuff like that.
Interesting. Rosemary or basil in your beans.
Yes. Our pink beans, and they taste magnificent. I'll send you some.
I want to taste too.
No, that's good. That's good. I mean, you struck me on that data piece, right? Like, that's something that we were missing. We had this conversation yesterday with Keisha and Clyde. We don't have enough data to govern how we do things. And everything from cancer and, you know, what parts of the island, water quality, you know, the foods that we're eating, weight. And I think, you know, as you mentioned, if we have a system where, you know, all of the providers are talking to one another, now you can start to gather reports about our population, about what's needed, and create a business out of that and saying, hey, to the farmers, hey, we need farmers to grow these things, to treat these things, to help our community eat better. Using TikTok videos, because people love TikTok. You know, they love I'm not on there. I try to get on there, but it's just time consuming.
It is.
But using that as a way to speak to an audience and say, hey, kids, here are ways to eat better. Here are ways to, you know, spice up your food without some of the harmful things or, you know, the overbearing. Because people here love rice and they love, you know, seasoning and spices. And I know it's hard. Like, my kids went to school in the States and they would not eat. You know, when he was 5, because they didn't put seasoning in their food. Like, the school food didn't have no seasoning, and he wouldn't eat.
But like you just said, seasoning does not have to equate salt and MSG.
Correct.
And somehow along the way, what was beautiful, which is we love flavor, turned into salt. So
Correct.
there's education that is needed. But what I think is missing in part of this is, if we go back to the lessons of COVID, we all were like, oh, we learned so much, but we've forgotten. We learned that our parents and grandparents could use technology. We learned that we could. We learned that we could work from home. And we go back to old habits, though. And I say that because, yes, we may have a generational divide with farmers, or even we see it in the medical community. We see it with physicians who've done business a certain way, and now you're asking them to use technology to do it another way. But oftentimes I think we make it too technical. So it becomes a barrier. It becomes something that makes me feel ashamed or intimidated, where what we can do is what happened in COVID. When grandma could not speak to her grandchildren, she figured out how to sit there with the phone, and she would just say, somebody come, show me how you could see me, you could hear me. And we kind of need to do the same thing now by pairing students, the younger generation, with elders, so they could say, how does TikTok thing to work? Because if I want to teach young people, no, you should be eating this. Well, okay, thank you for telling me what I should be eating. Let me show you how we can tell my friends how to do that, and reduce the barrier to, you've got to go take 2 years of technology courses or coding. It's not true. And we've proven that in a partnership with Howard University, we were able to get under their grant funding for something that's called PHIT, Public Health Information Technology. And we were able to offer for the last 2 years free upskilling courses online to people already in the medical field who might say, I'm a medical assistant, but I really want to understand electronic medical records because I want to grow in my career. And we were able to put 50 Virgin Islanders through this program for upskilling, for better jobs in technology, but proving that it can be done weekends, evenings, courses that are hands-on, showing you how to use technology to do your jobs better or to get into jobs of the future.
Did you guys market that? Because I didn't see that.
We did market it. We marketed it mostly within the medical community to providers' offices, to physicians' offices.
But more as a
We
success
didn't
story,
do-
right? Because one of the things that I keep telling people over and over, I've told every governor this because it hasn't changed, that we don't market the good that happens, right?
Absolutely.
So that was a great thing to happen. So I'm not saying market it beforehand, I'm saying after the fact,
yeah.
hey, here is something that has just happened. We have 50 providers who now have these additional skills through a partnership with Howard University.
Yeah, you're right, because then we can grow that. Whether it's with Howard or another university, Howard's now become exposed to our community and the needs, and so they're willing and wanting. And I'm sure that's true. We all came from schools that we graduated from.
Yeah.
So you're right, as the word gets out for the need, there are partners. To me, that's the good news. We don't have to do this in a silo. We don't have to reinvent the wheel. We don't have to do it alone.
Yeah, and the other part I think with marketing it is that the conversation or the what they see, and these conversations serve as a accelerant to get other businesses and other people who want to do these things to know that it's an option, or even to do it on their own to upscale themselves, because now they got competition. They got somebody who's doing better than they are, and I love competition for that, right? It's not a bad thing.
It pushes you to do more.
It pushes you. And my friends and I in college had a healthy competition. We always looked at, okay, well, you got 100. All right, I'm going to try and get 100. You got this nice job. I'm going to get a job that fits me, right? I'm not going to try to match you in terms of salary, but I'm going to get a good job that matches my skill set. That's healthy competition. I think sometimes
Cooperation,
Cooperation.
and
Yeah.
competition.
That's the big
yeah.
word in agriculture too, cooperative. And Summer and Dr. Peterson and I have spoken a lot about cooperative and farming. And it's basically what everybody's talking about. We all need to communicate more. We all need to share more resources. So it's all a cooperative mindset if you look at it.
Okay, cool. All right, so we're coming up to our break. When we come back, I want to continue this conversation about, what's next, right? What's missing? One of the things you told me over Christmas break was, man, I love to see that we're doing things with technology. And what are some of the opportunities to do more of that here? You listen to WTJX, Analyze This with Neville James. I'm your guest host, Shomari Moorehead. We'll be back shortly. And we're back. You're listening to Analyze This on WTJX. I'm your host, Shomari Moorehead. With me, we have Michelle Francis and Sumaya Bryan. So during the break, we were talking about, cooperation. Michelle, you had a great idea. Tell us more about that.
Getting people to the market.
Yes. So I know that, I like fresh goods, but I live in Mid-Island or West, depending on the time of day. But having to go to the farmer's market, to Sage Farm, to Art Farm, to the lady on the side of the road, it's a lot, right? And what's an opportunity? I think both of you will talk about that. What's an opportunity to do better so that more farmers can sell their produce and more consumers can buy fresh goods?
So when you were talking about opportunities in technology, there's one waiting for someone who, working with a technologist, an app creator, to figure out a pilot program with, say, 40 farmers and tracking what is it that you grow. You got lemongrass, you got basil, you got rosemary, and dasheen. And you've got, mangoes and bananas and papayas. Putting that all in an app so that I know on Saturdays when I have to drop my kids to track, to soccer, theater, I can go to the marketplace and I know that the farmers that are selling, I want cocoa sticks. So I know Jane will have her cocoa sticks because I could see it in the app. I can see what, if we do a pilot, because when we try to roll out and say it's for the whole island, it'll never happen. Start small. Use an app to know what's at a marketplace and to encourage other farmers to sell in one central location.
Do you think farmers are ready for that? Or do you think the community is ready for that? And that's actually the next question. Like, are we ready to adopt something like that? Like, I think we are, but I also know that we're not as, we say we like these things, but, it's a lot harder to convince people to say, okay, yes, I'm going to do this, and it's on both sides, right? I'm gonna have my inventory ready. I'm gonna tell you exactly what I have, and not just like, well, let me see what I have, and it's gonna be like, no, I know I have these produce, I have this amount, and this is what I'm able to sell. Versus, well, I just sell what I sell until I sell out. What do you think?
So one thing I will say is that there are two farmers or two organizations that already have apps that do kind of the similar things, but it's exactly what you say. It's like, are they marketed enough? Are people ready to use it? Good Food VI has an app for farmers to use with their produce. Nate Olive in the rainforest also has an app where he has a cooperative of farmers that work together. I say that cooperative word loosely, to get their produce together to sell on an open market. I personally think I always say, Dr. Peterson, Summer, and I always say, like, the market, the cooperative mindset is what we need. And I personally feel that the market cooperative is what we need. People love a grocery store. As much apps as we have, there's just certain people that just love walking through a grocery store and seeing the vegetables, especially with the chefs that we got out here. They want to see what the red pepper look like, and they want to see what the garlic looks like. You can offer those platforms for, like, people who like drop off. I just want to go pick up my groceries really quickly. I would love to see that in the Virgin Islands. But I would also like to see the market cooperative, like Michelle was saying, where we can actually go to one store where you don't have to go like from east to west looking for groceries and a certain item that you're looking for. You can just go to one store where all the farmers are there, all the fishers are there. They're selling out of cleaner environments. There's a standard price. It's going to be open from Monday to Friday, 8 to 5, standard, so that people can just always go and get their produce. And it would also open up more money, more of the East Enders, more of the tourists, more of the people from St. Thomas that don't know exactly where to go on island to find certain things. So that's what I will say.
How do you think our grocery stores would take that? Like, if we had like
competition is needed.
Yeah.
How do you know how to get better? I mean, look, Pueblo is finally paving their parking lot. This is like a crazy idea, but it's competition. You got to get with the program. Even all these little bodegas, like, they all have to compete. Yeah. That's the way the world works.
No, you're right. You're spot on. In Atlanta, there's this place called the DeKalb Farmers Market.
I love it. That's my favorite place to go.
Yeah, when I went up there, I saw that they had things like lemongrass, they had coconut, they had sugar cane. I was like, wait a minute, this is Atlanta. I'm not expecting to find Caribbean produce there. but they collected all of these things from farmers, locally in Georgia, strawberries that were grown, peaches, stuff from around the world. They had imported, but you can find everything. Yes, you have your Kroger and your
The Publix
and all these other
Walmarts.
stores and your Walmarts, but you had something like this. And I think, you get the spot on. Like, we need a way to have a market, like a real market where our farmers aren't working from 4 a.m. to noon and then trying to go out on the street and sell.
Yeah, that's not their job. They need to get back to farming. That's what they do best. They're not sellers. They're not marketers. They're not so let them get back to it.
My uncle had like 50 acres in Mumbiju, and he always
Wow.
asked me if I wanted to farm. And he was
It's a
like,
gold mine.
he's like, come be a farmer. And I was in my 20s, and I was like, no. And the land is still there.
Wow.
It's
You got to get with a farmer. So many farmers are looking for land that they don't have the space. They might not have the equity, but they got a few slips that they want to plant. So
really,
Yeah,
it's right at the top of the hill. Henry Carter was his name. He was my mother's uncle, my grandfather's brother.
wow.
And he had all this land that he would farm, and all his whole life he was a farmer.
You don't even need big plots of land. I moved back home from Chicago. I lived downtown Chicago. And in my community, there was one of the community centers had less than an acre. I would say it was maybe a quarter of an acre of a yard that they used, and they created micro plots. And you could go on a waiting list, and you would sign up to, and it was for free, but you had to manage your micro plot. The amazing thing about it was so much was produced out of this quarter acre that they provided a farmer's market. So if you did tomatoes in your little micro plot and you had excess, which you always do, you could come by and buy them. And then that's now moved to an app, so you can see what all the farmers markets in the South Loop of Chicago have, so that when I go out on Saturday morning, I can hit this one because that one has what I need. So I think you got plenty of land.
There's
like
a
I
lot
said,
of farmers
so yeah,
looking for
being able
land.
to sublet some of that land,
Yeah.
do these micro plots. I mean, there's so much opportunity.
Yeah.
Again, it goes back to marketing it, right? Farmers can't sell. They can't work and sell
Yeah.
all day long. It's hard, right? It's hard to do all of this work, out in the hot sun or early morning, and then turn around and have to go on the road. And my uncle had that challenge. He was like, it's hard to find good help to farm. And he was, he died when he was in his 80s, I think.
Wow.
And before that, he was like, yeah, it's me and his wife, and he would get some occasional help, but it wasn't that much. And I know we had 4-H when I was growing up, which would teach kids about farming, but I don't know if it was ever sustainable where we developed another set of farmers or enough farmers to support the work that we need done.
So there is, I have great news. There is hope for the future. UVI is graduating their first agricultural business or agricultural class, bachelor's class, first one. So, but the problem is, yet again, it's like you have what about 10, 12 people that are ready to graduate with agricultural degrees, but no land, we're just battling getting out of school, battling student debt, just like a regular person. But, we don't have land to farm on because all the ag land has been taken up. Love to see it.
What about the stuff in across from agriculture? So where the old lieutenant governor's office house was, by Paradise.
Well,
They had cleared all that land at one point. And I was worried. I was like, I hope they not put up another shopping center.
Yeah.
But now it's grown back. So right across from the flea market, heading east, there's a whole plot of land that belongs to the Virgin Islands government.
So I think that creates an opportunity for you to invite the Commissioner of Agriculture and let him know in advance. We want to know about what land is available. For lands that exist that are overgrown. Is there opportunity to sublet to farmers who are graduating and ready to try something out? So can you do it at a reduced rate if the land is just going to sit there? I think we overthink some things that have obvious solutions, okay, instead of having to create, what's the 10-year plan before someone can access the land? No, the land's sitting there. So can we again, pilot something for a year. So we know there's a start and finish, and we take the lessons of what worked and we discard what didn't, and then we move on.
Okay.
And speaking of another organization, the EDA also has a program right now that I think they're creating a value added warehouse in Frederickstead for farmers, or kitchen
Yep.
for farmers to come in and create their own value added products. They don't market it enough, I keep telling them, but that is an exceptionally great, thing to have.
Yeah, they actually just bought a building on King Street, and so the goal is to turn that into a clean kitchen. So I know they have two that they're planning. One in St. Croix and one in St. Thomas. They have slightly different uses for them, but you can, if you're a cook that likes to bake and you want to bake at scale, you have ovens to bake in. Because right now everybody bakes from
Test
home,
kitchens,
Yup.
yeah.
but you have a space where you can reserve and you can bake at scale. You can, package. You can dry, air dry your stuff. You can vacuum seal. I think she even talked about doing a room where you can have like TV interviews, you can do cooking shows and things like that. So we need to integrate more of it in, really helping one another, because there's opportunities, right? We have all these old recipe books. One of the things I actually started was digitizing that and putting them into the MyVI app. I took it out, but we're something we're going to put back in, where all the old Virgin Islands recipes that we had that didn't use a lot of salt but use a lot of flavor, letting people know about those things, the 50, 60-year-old recipes that nobody cooks that stuff now.
And there's another opportunity. You're talking about what opportunities exist. Hydroponic farms, or putting a farm in a trailer, would be ideal for our new hospitals that are going to come on board. So even if they say, oh, we don't have any more land, you have a parking lot space that can house a trailer, what better place to provide fresh food? You've got to balance the diet for your patients that are in-house, than to do a collaboration between agriculture and the hospitals, or with a farmers collaborative and the hospitals. There's again, sometimes I think we overthink it. And this isn't a new concept. This is being done. And again, ChatGPT helps us. Just ask, are there hospitals across the U.S. partnering with food as medicine? What does that look like? And so we don't have to reinvent the plans, the business plan. That's an easy way. That's not intimidating to use technology, is using AI to say, what would a business plan look like?
I love it.
For ABC.
Okay. Here's a big piece though, funding, right? So I know you've dealt a lot with like CMS and the feds and stuff like that for funding, to get this, information exchange, this health exchange. On the farming side, like, where can we get access to capital? Because like you talked about the folks graduating, they're going to need capital for equipment. They're going to need capital for marketing. If we want to get to a farmer's market, a real homegrown farmer's market where we're getting stuff from, all the farmers, they're not on the side of the road anymore. Kind of the vision that agriculture had with the fish. Like, we had a place for fish, and now it worked for a while, and then they closed it down, and then they fixed it up again, and now it's closed again. And now the fishermen,
the other day.
the fishermen are back to, on the side of the road, instead of that facility that we had for them. Like, these are behaviors, right? These are not necessarily a technology problem. It's behaviors. It's systems that are not working.
Yeah.
So how do we, what's your thought on how do we fix that?
I mean, personally, not everybody has the advantage, but I just call the governor. But I know not everybody has that advantage, because just the other day my building sits across from the fish market. And for those of you who don't know, I was studying to be a marine biologist before, and I love the water. I love diving, fishing. I'm a rescue diver, all that stuff. So I love the fishermen. I love the community. But I always look out at that building and I'm like, why is it always closed? Like, they're selling outside of it. Like, who can we talk to? How can we get, to the space?
Can we put some pressure on the big boss?
I hope so. I'm about to call him just now.
Well, but you talked about behavior and patterns. There's also incentives. We don't really do a lot here with keeping people accountable.
Okay.
And using incentives and maybe disincentives for that. And I'll weave in financing. tied into most grants is accountability.
Yep.
So a lot of times, I'm gonna give a hard pill to swallow. A lot of times when people are like, there ain't no money out there, why the government know? There's a lot of money out there. But that money comes with
Accountability.
Yep. It comes with having your house in order, because you're first going to be asked for data.
Yep.
Then you're going to be asked to track your data to show that the money helped you grow what you were going to grow. So I'd say before, we always, you hear it all the time, well, why they ain't got no money for that? We need more money for this. Well, before we have the conversation about someone giving us money, let's have the conversation about getting our houses in order. We really have a lot of work to do on that end. Then there's a lot of technical assistance that the government, I know because I've had to use it myself, will give as you're writing for and managing a grant.
So who are some of the places you can talk to for that? So I'll give you some. The first part you talked about with data, right? So I created a software for that, for business or payroll, because I knew during COVID with like payroll protection loans and all of that stuff, they needed payroll data, and a lot of people didn't have it. So I said, okay, we'll create a payroll platform so that small businesses can track and have data in case another emergency or something happens, when they say, hey, show me what you've paid out, where are your forms, what have you filed? Like, we have all of that stuff now. But again, it's technology, and people are slow to adopt technology. But now with the other part of that question, who can you call? Is it SBDC? Is it, EDA? Like, who can you call for technical assistance?
Yeah.
ABC? Like,
I think it's all of the above. And again, I'm going to go back to your point. That is a great use of AI to say, I'm feeling overwhelmed, so I'm going to ask ChatGPT, where can I go to find funding as an agriculture? What websites provide grants? Like, again, we overthink it and get overwhelmed with things. Where first start there, then you do the research. Then you click on the links that when they give you 10 links, the links aren't going to write the grants for you, but it's going to give you, here's the organizations to go to. Go to those organizations, do some more work. I think this is where an older generation and a younger can utilize AI. This is a safe place to do that.
okay. Cool. Well, we're going to take a short break. We're going to wrap up this conversation on agriculture, technology, and healthcare in the Virgin Islands. We have our special guest today, Michelle Francis, Sumaya Bryan. I'm your guest host, Shomari Moorehead, on WTJX, your NPR station in the Virgin Islands. And we're back. You listen to Analyze This on WTJX, your NPR station in the Virgin Islands, 93.1 FM. Michelle and Sumaya, back to healthcare, Michelle. Before we end this, we got 16 minutes left. What's the future look like? What are opportunities for, tech entrepreneurs like myself to help with what you're doing? What do you need help with? I know the hospitals are probably your two biggest, challenges right now, but are there any other opportunities that you see or that you need help with?
That's a good question. It's a little overwhelming. The answer is yes and.
Okay.
Yes. There's major opportunity because we're just on the cusp of really tapping into our data. Once we're able to do that through the infrastructure that we're putting in place, there's endless opportunities. There's no going back. I say that because especially in our provider community, there's a sense of, well, if I just put my foot down, I can hold the brakes. There's no holding the brakes on technology. What happens is we'll fall farther behind. So one of the first big opportunities I see is in helping small practices, but also big agencies like Department of Human Services and Health find affordable ways to digitize their backlog of paper. That we are like 80% still paper in the Virgin Islands. When we did a survey where we use technology, but then we still go back to old habits, and depending on who's the manager, who's the administrator, we're still doing things in ways that can't be integrated. So we've got a lot of paper that needs to be digitized. We spoke to Google about doing that. There are tools out there. We've got to figure out affordable ways. It came down to the money and ways for that to be affordable for providers, individual providers to do that. People talk about wearables and apps, but my caution is before we give everybody more wearables and apps, it has to connect to something.
Yep.
What my office is doing is building that foundation. That's like being like, so what we want in the house, we want windows. And you've gone and bought windows, you've gone and bought doors. Nobody's laid a foundation, but we're buying rafters because I like rafters. We're buying, decorations, but the foundation is what we're working on right now, which has to be done. So wearables, yes, there's a place for them. But if we want to connect those to your medical record, we've got to get that infrastructure in. And then there's opportunity, because that's what people jump to. They're like, the opportunity is wearables, eventually. But we've got to get the foundation of the house laid and then build those walls. So the opportunities are somewhat endless, but I'd say starting with digitizing our data. And there's a lot of room for my office to do continued education to the providers on federally approved technologies, their electronic medical records, which will enable them to connect to the HIE. Because if you're on an outdated technology that's at high risk for a breach, it's harder to connect you. So there's a lot of onboarding and education that we have to do.
What about healthy competition among ourselves in terms of living better? So I know from time to time, Department of Health will have these walks, for kids with diabetes or the government insurance, what's the government Cigna, one of those companies will do these things with health and fitness, but it's not sustainable. It's kind of like these one-off projects. Are there opportunities where we can have we can just challenge each other as individuals, as a community, say, hey, I'm going to live better. I'm going to eat healthier. I'm going to, work on my blood sugar. I'm going to work on my weight. I'm going to work on eating more fish and less meat. Like where is that opportunity? Because I don't really see that even in apps right now. There's apps to compete on, like the Apple Watch, for example. I can compete against my brother and my sister, my cousins in terms of physical activity. But health is more than just physical. It's about what you eat, right? Are there opportunities for that?
Absolutely. I'll hand it off to you, Sumaya, in a second, but I think I've started going back down to what I call the old Martin Marietta track across from Captain Morgan. That place was amazing when we were kids. I have so many memories that are all health fitness related there, where I went to Free Will. Free Will used to do a walk that went all the way out to like the Point Udall, to Kramer's Park from town, and it was parents and kids. We would do all kinds of, like 4 times a year, there was activities at the track that involved the whole family. So when we talk about technology and the divide, and where should we still be hands-on? Where should we maybe not rely on technology? It's going back to things that we were doing, that are, the track is still out there. That facility still has all that property. You can go, I went with my boys running and walking just the other day.
So cute.
But there's opportunities for any kind of group to say, we're going to get seniors walking. My mom goes walking with a group at Lagoon. But we also have Mid-Island. We have that amazing facility there. So I think it's getting people, again, it's easy to complain and stand on the sidelines, but we need more people to just get in the arena and try something. Call your friends, call your neighbors, call your schools.
Honestly, same thing. Working out, I feel like working out is definitely an excuse, and I was definitely like, oh, like I have to pay for a gym membership. Like, no, like working out in the Virgin Islands, in St. Croix especially, is so easy. Like on Sunday, I just went to Jack and Isaac's with 3 friends, you know, just did that walk. It was such a beautiful walk. It wasn't long, you know, it wasn't hard, it wasn't treacherous, you know, just did the walk, you know, look at the beach, get outside. I lost 20 pounds from just walking farms, you know, just doing that. So I would implore everybody to step outside. I know it's hot, but, you know, just step outside into nature and just look around and just go on hikes. There's so many hikes in St. Croix that you can go on. I've done the Goat Hill. I would definitely not recommend for your first time. But, you know, try the lighthouse, try something simple first, and then do that.
I did Annalee, and not the Wills Bay that everyone goes to, the real Annalee. With Olassie Davis about 2 years ago.
So good.
Dude, man, they told us it was going to be a 4-hour trip. They said from 7 to 11.
Oof.
So and they said pack water, pack some fruits. I packed enough for 4 hours. It took 4 hours just to get there because he stopped and talked and stopped and talked. He lost half of the group by the time they got there. Because people would turn there around and like, I'm going back. You know, we got to the water, and I took my 8-year-old. And he didn't mind the walk. He was more concerned with the talking. He said, I just want to get to the water and swim. And so we let them go around the hill to the actual tide pool. And we stayed in the water and swam for a little while. Yeah. And then they kind of met us coming back. And he said, oh, we're going to take the long way back. We're going to go to Wills Bay, where everyone goes to the pictures you see. Yeah. We're going to take the hike that way, then back to Carambola. Wow. So we're at Carambola having lunch, you know, resting my feet. Wow. And when we're getting to leave now, we've been there for like an hour and a half. They're finally showing up. And it's like, I think we started with a group of 17. He came back with like 7 or 8. Wow. The rest of the people left. So it's a real hike. Like it's, you know.
Yeah. But they're easier ones to do.
Caledonia is beautiful too. Now it's raining. You know, that might be a good time to.
There's where you can bridge technology. So you can help people with your own experience, and you're a technologist. Find hikes that are 2 hours and less, an hour and less, 4 hours and less. Because to me, you created that point though, which is. People might want to do it, but they're like, I don't want to go.
Because then you get trapped.
8-hour hike, right?
Because I went with my cousin Jade Bryan. She's like a fitness guru now, but she was like, "Oh, it's fine. It's just gonna be like a couple of hours. It's a great jog, great low hike." It was treacherous, I definitely regretted it, but when I got to the top, absolutely did not regret it. But
So if you use technology to list like hiking trails,
yeah, because people are posting already. So being able to aggregate link us, use this hashtag when you do the Jackson Isaac so people can see what it looks like along the way. So it's because people already, I do it. I take pictures, take video. The Jackson Isaacs is an easy one. Like when I recommend to people, I'll say, oh, yeah, if you've got someone over 70, maybe this is flat, do this one. If you've got, small kids, well, mine aren't small anymore, but yeah.
And what about eating now, right? So you talked about the rosemary and basil in your eating. Like, how do we encourage others to do similar things?
Can I jump on that real quick?
Yeah.
I saw this with my kids. So I always told everyone, I have a brown thumb. I don't know why I said that,
we'll work on that.
My dad had a green thumb, and we had property in LaGrange, and my dad was a proper St. Lucian. He grew breadfruit. He grew everything on that property. But I was like, no, my St. Lucian roots are one generation removed. But in Chicago, I discovered everyone would come to my place and I had orchids everywhere. And they're like, oh my God, how do you grow orchids?
It's
And I'm like,
extremely
I
hard.
don't know. I have a brown thumb. And they're like, no, you don't. Then I came home and I was like, I have a brown thumb.
Yeah.
But I had a little tiny patch that just kept growing weeds. And I decided to try planting tomatoes because my mom always had tomatoes. Well, the tomatoes grew wild and crazy, lemongrass, and then my mom grows pineapples. She told the boys, here, take the top of, just chopped off the
Yeah.
top and was like, go throw this in the yard. We harvested a pineapple. I saw the connection in my boys' eyes from like, oh, just chop off the top of the pineapple, throw it in the yard. And when we harvested that pineapple, I saw with them the like, oh, this is what
Yep.
the earth can do for me, because I love pineapple, and being able, they were so excited to cut it and so excited to say, look what we grew, and the same with the tomatoes. So I think that just being able to give small opportunities. I don't have 50 acres.
Okay.
I have a little tiny piece of my yard, but we literally throw things in. Now it's got a little box and we see what grows.
Nice.
So,
You have to have patience with pineapples because
Yeah.
yes.
my
a long
the
time.
neighbor from across my father's house gave me some pineapple, just a top, and I planted them in my mother's yard, and I'm still waiting.
Wait.
It's growing.
coming, it's
The
coming.
top is coming out,
Yeah.
but it's been like 2 years.
Okay, it did. You're right. So
Yeah.
it took 2 years, and
You
we
have to
have
have
like 5
patience.
more. But
For kids, that's good, though.
But you could do tomatoes. Tomatoes will grow like
Yeah. And
Yeah.
I
Like
did
that.
bring you guys some parsley so you guys can work on your green thumbs.
Okay.
So when we come back, we can, you know.
We talk about that, yeah. But I think that's the opportunity, right? You know, using TikTok, you know, getting the kids to post about, you know, what they're growing.
Yeah.
Getting adults, you know, our age group to post what we're doing with food to encourage others to eat healthier, right? You know, we want to have a longer life. We want to eat healthy. I don't eat a lot of butter. I don't eat a lot of dairy stuff. I just never liked it. So I don't have people, when I go to get fries, and they're like, oh, you want mayo? I was like, no mayo for me. I just want
Yeah.
ketchup. They're like, who doesn't eat mayo on their
Sakujande,
fries?
You got
Yeah.
mayo and ketchup.
I don't like mayo. You know, I don't like mayo. I don't put butter on my bread. When I go to the deli, and she's like, "Oh, you want mayo and oil and vinegar?" She's like, "You like your sandwich dry?" I'm like, "Yeah."
we're gonna say you might be in the minority there, but
Yeah.
I am in the minority there,
We
but
respect it. We respect it.
I try to eat healthy, right?
Yeah. And one thing about the kids too is like the same thing with Michelle is like what I'm trying to explain to people is like, oh, they're like, oh, my kid don't eat greens. Like if they planted it, they're gonna grow it.
Got
They're
it.
gonna eat it.
they are.
You
gonna
know.
eat it.
So
Can we
there's that.
use technology to help them track like soil quality?
Absolutely. We have a bunch
water.
of soil pH meters and water pH meters for the hydroponics and stuff like that. So we are actively collecting data on that in different areas or trying to work on that for the new year.
And down here, we don't talk as much about our local influencers, but there's opportunity
To work with
bringing
them.
and to raise new influencers. There was the quarter zip, the 3/4 zip challenge,
Yeah.
and trend got people drinking matcha. So
Yeah.
there are positive ways to use technology and our young people and their enthusiasm to shift a mindset.
Absolutely.
You could have asked people 2 years ago, 15 years old, you want matcha? They're like, ew,
No.
no. Now it's like, oh yeah, I'm going to have matcha.
And now matcha farms are running out of matcha. They're trying to figure out new ways to plant matcha so that Americans can drink their matcha.
And that was marketing.
So
Oh wow. Cool. Well, we're coming to the end of the hour. We've got standards to set. We've got a lot of work to do. Final thoughts, Michelle, on your work and how we can really transform healthcare, how we can use technology to help us.
Yeah. As we're facing the end of this administration and moving to new, I am very aware of thinking of what we've gotten done, what still needs to be done. And am very grateful for the vision that Governor Bryan had to establish this office, to really put real support behind modernizing healthcare, not just talking about it. And I hope any future administration keeps that focus, because I've seen our docs go from apathy to really hopeful engagement, because at the end of the day, they really need the tools and want the tools to care for their patients. I think that will translate across opportunities coming from agriculture, from working with young people who can help them modernize as well. So I'm excited about the future. We do need to keep a focus and not just hope. Hope is not a strategy. We can't hope things will get better.
Samaya, 30 seconds. What do you think?
Yeah, I just implore everybody to visit the school gardens, visit your local community garden, get outside. The agricultural fairs come up, support your local vendors, support your local farmers, and just continue to support us, And I love proactive parents. If you're going to come out, please come out to the schools and see what your kids are doing. And have a great day, everybody.
So Ag Fair actually is coming up, and we're actually going to use the MyVia app to plot out all of the vendors, so you know
Super
where
cool.
to go.
Nice.
I loved your encouragement from Christmas time when we did that with the festival village. So we
Yeah.
can do the same thing for the
And
agriculture.
Save that data of the business names and members and what they sell and all that stuff.
Okay. Yeah, we definitely have that saved.
Promote
So
the app.
download the MyVI app, and you'll find all of the Ag Fair stuff in there.
Awesome.
Cool. Thank you for joining us. It's been a great conversation. You'll listen to Analyze This on WTJX, your NPR station in the Virgin Islands. I'm your guest host, Shomari Moorehead. I'll see you back tomorrow, and then next week, Neville James will be back.
The views and opinions expressed on Analyze This are entirely those of the on-air participants and do not reflect those of the station's board, management, staff, or underwriters.